And good day. My name is Brian, and I'll be your event specialist today. At this time, I would like to welcome everyone to the webinar, ImagineNation Data Impact Challenge. All lines are muted on today's call to prevent any background noise. We will not be taking audio questions over the phone. However, you may submit questions throughout the presentation by locating the Q&A panel on the right-hand side of your screen, typing your question in the open area, and click Send to all panelists. If you happen to experience any technical difficulties during today's conference, press *0 on your telephone keypad to be connected with an operator, or simply use the chat box on your console to speak with me directly. At this time, I'd like to turn today's program over to Canada Health Infoway. The floor is yours.
Thank you, Brian, and welcome everyone to this afternoon's webinar. We're really excited to have you all on the call, and we're going to be talking about the Data Impact Challenge. I'm Fraser Ratchford, Group Director of our Consumer Health and Innovation program here at Infoway. We'll just go through a bit of administrivia before we get started. So please note that this session is being recorded. And should you have any questions that you would like to ask us, please use the Q&A feature. And at the end of the presentation, I will pose those questions on your behalf. And that way we can make sure we get as many questions answered as possible. So this is actually our 9th challenge that we've offered at Canada Health Infoway, and we have a large challenge family already who have been participating with us in various challenges. But for those of you who are new and do not necessarily know much about Canada Health Infoway, it is we work with various partners across the country in the development and adoption and effective use of digital solutions across Canada. Our vision is healthier Canadians through innovative digital health solutions. And with that vision, we have 5 areas of strategic focus, such as bringing care closer to home, providing easier access, supporting new models of care, improving patient safety, and enabling a high-performing health system. And we're excited that this particular challenge, the Data Impact Challenge, will contribute to all of these focus areas. So as I said, this is our 9th challenge over the 4 years that we've been running them, and each of the challenges seeks to inspire, provoke, and promote innovation in the health and healthcare system. These have ranged from soliciting Canadians' ideas on how best to improve health and healthcare using digital tools, to using innovative clinical and consumer tools and increasing their use or increasing their quality. We're excited to be having this next challenge, and it's not possible without the supporting organizations that help us define and promote each of these challenges. We've welcomed 3 new supporting organizations to our challenge family with this newest challenge. And once I introduce Simon, he will talk about them as well, and we actually have a couple of them on the line today. So today's proceedings, what we're going to do is Simon Hagens, our Director of Benefits Realization at Canada Health Infoway, will be giving you the background on the challenge, introducing a couple of our supporting organizations, and we're going to hear from them. And then we're also, he's going to give you some explanations about this challenge. Please note that we aren't accepting questions about the challenge questions per se, but on any of the administration of the challenge, certainly ask your questions away. And I'll be moderating them, and we'll deal with that at the end, which is once we get to the end, we'll sort of deal with the questions and have a wrap up, and we'll have you out of here by within the next 56 minutes. Okay, over to you, Simon.
Great. Thank you so much, Fraser, and great to see so many folks on the line. Thank you so much for joining us. As Fraser said, I'm going to talk to you a bit about why this challenge is important for us, and I'm going to hand it over then to some of our supporting organizations. So we're pleased to have Kathleen Morris from Canadian Institute of Health Information and Sarah Penrith representing Choosing Wisely Canada, who will speak a little bit about their interest in the challenge. And then I'm going to go through some of the logistics of entering, and then we're going to open it up and leave lots of time for you to ask questions about the challenge. So here's the purpose of the challenge. We want to source relevant information for a set of questions on topics like quality and appropriateness of care identified by policymakers. And really what this is all about is testing the feasibility of a new mechanism for matching stakeholders who need information to inform policy or practice with those who can provide valuable input. Now, for us at Infoway, we had a couple of drivers. As Fraser's referenced, our mandate is really all about digital health. We've invested substantially in health information systems across Canada for almost a decade and a half at this point in time. And so we've got lots of information assets that we'd like to be able to be leveraged. In my role at Infoway over the years, I've done a lot of work in benefits evaluation, and we've had a number of questions we've tried to answer that we thought, you know, there's got to be somebody out here that has the data to answer this question, but it's not always that easy to figure out who actually can answer that question and then be able to structure an agreement so we can collaborate and find an answer. So that was sort of at the back of our mind. It had been a challenge we've been working on for over the years. The other real business driver for us is the interest in health system use of data. And so especially over the past few years at Infoway, there's been an increasing focus on how do we ensure that all the data assets, all this digitized health information can be put to the best possible use to inform our health system going forward, whether that be at the practice level or whether that be making health system decisions. So this challenge is really an opportunity to explore some of these and look at mechanisms that we can accelerate the use of information to inform decision making. So that was our interest here, but I'm going to turn it over now first to Kathleen from CIHI. Kathleen, I invite you now to make a few comments.
Thanks, Simon. We're very excited to be involved with Infoway and specifically with this project. At CIHI, we really understand the importance of using data to make good health decisions and specifically to identify and to measure progress on initiatives that improve quality and appropriateness for everyone. CIHI sees ourselves as a trusted source of Canadian health data, but we know that our data is only a piece of the puzzle. There's so much great information that exists across the country, and many of you on the call will be able to work with that information. Very much looking forward to seeing the data impact challenge proposals that are developed and show how data from many places can be harnessed to answer important questions and hopefully at the end of the day improve healthcare in Canada.
Great, thank you so much, Kathleen. And next I'm going to ask Sierra Penrith, representing Choosing Wisely Canada, to say a few words about their organization's interest in the challenge.
Hi, we're extremely excited to be involved with this challenge. And for those of you who are unaware of Choosing Wisely Canada, I'll just provide a brief overview of the campaign. There's growing concern about the rising costs of healthcare expenditures and sustainability of our healthcare system. And it's estimated that 30% of healthcare spending in the United States is wasteful. The greatest contributor of wasteful spending is unnecessary care. Tests, treatments, and procedures that don't add value to care and may, in some cases, cause harm to patients. So the Choosing Wisely campaign was launched in 2012 in the United States by the American Board of Internal Medicine Foundation in response to these concerns. It was an attempt to change physician behavior and improve professionalism through the just distribution of finite resources. Choosing Wisely Canada is modeled after the American campaign and launched just over a year ago. One of the key elements of the campaign is that it's a physician-led with specialty societies creating lists of tests, treatments, and procedures that patients and physicians should question. So these recommendations are evidence-based and have significant potential to cause harm or be wasteful. So for example, don't do pap smears in women under 21 or over 69 years of age. Since we've launched, over 45 specialty societies and all provincial territorial medical associations have committed to the campaign, and our early adopters collective of hospitals and practices is steadily growing. The campaign approach involves engaging physicians and other stakeholders. For example, in Ontario, we've partnered with Health Quality Ontario for our provincial strategy, as well as raising patient awareness through patient materials. As we move into the implementation stage of the campaign, we're looking for information on rates of overuse that will help us target our efforts. When we heard that Infoway was interested in including questions related to appropriateness in the Data Impact Challenge, we were thrilled. With over 100 recommendations to choose from, we're hoping to get additional data so we know which recommendations will have maximum impact for intervention efforts. So we're extremely excited to be involved and are eagerly anticipating your results.
Great, thanks so much, Sierra, and thanks to both yourself and Kathleen. Your organizations were really instrumental in helping us to prioritize which are the most important questions to ask at this point, and how do we frame those questions in a way that we can really get meaningful results and frame them in a way that folks across Canada will be able to answer them. So I'm now going to move on to the nuts and bolts of the challenge. What is it? How do you enter those kinds of things? So I'll talk first about awards. Everybody's keen to hear about awards. For this particular challenge, we have up to $80,000 on the table in awards. The first place award is worth $20,000, and that will be for the best answer, so the answer with the highest score across any question. We then have 5 runner-up awards, each worth $10,000, and those were for the next 5 highest scoring questions or answers submitted through the challenge. And then for all answers that are deemed acceptable, they are placed in a draw, and up to 5 of them will receive a $2,000 prize. So a substantial chunk of money on the table. Got a couple of slides to talk about eligibility. I do want to note that the challenge rules are available on the website, and the challenge rules are really the source document. So if you're planning on participating in the challenge, absolutely have a look at those rules, make sure you understand them. The eligibility is gone through in detail in those rules, but I want to highlight some of the key pieces here, and everything else you need to know really is in those rules, but I just want to make sure that we go over the highlights. To be eligible to participate, you need to be authorized to access and analyze data sets that can be used to answer some of the questions that are being posed. And you need to comply with all the applicable guidelines and processes related to the use of those data sets. So very important, obviously, all of you that work with health data sets understand the importance of complying with the rules and regulations, and absolutely that is part of this challenge. You also must reside in Canada and must use all Canadian data. For this particular challenge. Teams must register, and they must complete an answer submission template for each question they choose to pursue, and they must agree that there'll be public sharing of all of the submission information that is submitted to us, because those submissions will be made public. We also have a couple of eligibility requirements with respect to the organizations that we work with or have worked with in the development of this challenge. So obviously those that work for Infoway and our immediate family members are not eligible to participate, as are judges and their immediate family members. For supporting organizations, the directors, officers, employees, and agents are not eligible to act as team leaders, but they may participate as team members. And finally, directors, officers, employees, or agents of the federal government, its departments, agencies, and crown organizations are not eligible to participate. So we'll now move on to speaking about the judging processes. So the judging for this challenge, you'll note, is substantially based on speed of submission. So one of the things that we're really interested in addressing here is how quickly can we get answers to important policy questions. We recognize that often it takes a lot longer to answer a policy question than would be desirable. And so 50% of that scoring actually relates to speed. So for any given question, and there are 6 of them, the first qualifying submission will receive 50 points, second will receive 40, third will receive 30, and all subsequent submissions for that particular question will receive 20 points. So it gives a substantial advantage to those who go and seek answers quickly and submit quickly. The second half of the judging is based on the quality of that submission. 20 points is about the data quality. And what we want to know is to what extent do the data sources and analysis provide a credible, meaningful answer to the question as it's been stated. Following 20 points is for representativeness. And so that is really asking to what extent does this submission answer which could be relevant to a population or population-wide or pan-Canadian context. I think it's really important to note here that that doesn't mean that we're just looking for people that are bringing national data sets to the table. What we're asking is that if you're working with a provincial or a local data set, which might provide a very meaningful answer to the question, that you take into consideration how would I do the analysis in a way that this is representative as possible and useful for policymakers across the country. And the last criteria, the last scoring element, is around innovation. And that's basically to what extent are you using some innovative approaches here. That could be taking advantage of an underutilized data set. It could be streamlining processes to speed up time. It could be combining data sets were not previously combined. Or it could be really digging into some of the policy issues and understanding those a little bit more deeply. So that's the criteria that our judges will be using. A reminder that the judging process, obviously there's some subjectivity in all of these categories except for speed of submission. And so our judges will be looking at each of these submissions. There will be approximately 5 judges looking at each submission. So we'll try and get a good breadth of experience looking at each and get a good sense of the cream rising to the top. So the next slide is speaking to an option that we're putting out there what we're calling Ask an Expert. So this is giving people an opportunity to ask for insights on how they might go about answering some of these questions. The first 10 teams that submit a question to the expert's email address will receive an answer in 5 business days. You might want to ask about what would be an appropriate analytical approach to answer a particular question? Or are the data sets I have going to provide a meaningful answer? Or you might want to submit a draft completed submission and say, have I done this effectively? Are there other things I could do? There's a number of ways you can choose to use that Ask the Expert question. A limit of 1 per team, and importantly, it is a first come, first serve for the first teams only, and that opportunity does close on June the 15th. So finally, people want to know, how do I participate? So you can join as an individual or as a team. You want to check your eligibility in the rules. You want to really review and make sure you understand those rules. You can register your team and invite other team members if you'll be participating as a team. Go and select your questions. There are 6 questions, as I mentioned. Those questions are available now. You can go and read through those questions, determine which one or which ones you feel you'd like to be able to answer. Complete that answer submission template, and then submit it through the website. And at that point in time, it's time-stamped and it is submitted for judging. So the challenge launched today at noon. It is live right now. The questions are available right now. Submissions, registrations, and then submissions can begin anytime.
Perfect. Thank you, Simon. And so now we're opening up the floor for questions. As you can see here on your screen, please click on the Q&A, submit your question to the panelists, and then we'll begin answering them. So Simon, one of the first questions that we've received, and just based on that last slide you put up, is it tells you how to join and how to form a team, but can people join more than 1 team?
Yes, people can join more than 1 team, but they can only be a team lead for a single team.
Okay, all right. Another question that's come in is, can I publish what I find, and will Infoway be publishing the answers submitted?
Yes, so Infoway will be publishing the answers that are submitted, and those will all be released when we release the findings of all the judging, probably in this fall sometime. The ownership of that data remains with the team, however, and you can certainly go ahead and publish those findings. If you've got something that's relevant for a peer-reviewed publication, then following the completion of the challenge, you'd be welcome to pursue that.
Okay. Keep the questions coming in, folks. Next question is about the Ask an Expert. And so what's the timing on that? So can I, if I ask the expert, can I submit my answer too, or can I change my answer, or how does that work?
Good question. So when when you ask the expert will give you feedback within 5 business days. You should not have submitted your actual entry to the challenge before asking the expert. You'll want to be able to make any adjustments to your submission based on that feedback from the expert. And then you would actually make the submission to the website following any of those adjustments that you've made.
Okay. Here's a question. We have a Ontario agency that is an agency of the provincial government and not federal, and they just want to make sure that employees of that agency would be eligible to submit to this challenge.
Yeah, certainly they, employees of provincial agencies would meet our eligibility criteria, certainly. And of course, it's always important to make sure that you check with your own organization to ensure that you're making appropriate use of the data from the perspective of your organization and the custodians of the data. But in terms of the eligibility for our challenge, absolutely.
Okay. On that data line, what data is allowed to be used?
So there are going to be many different kinds of data sets across the country that could be useful for this. So we know that many organizations collect administrative health databases, and of course administrative data could be effective for answering some of these. We also know that some of the investments that Canada Health Infoway has made in things like diagnostic imaging repositories, lab information repositories, drug information repositories could be effective. We know of lots of organizations that collect primary care data through EMR databases or other mechanisms, and that could be very useful. Often a large health region or a large hospital might have a clinical information system which contains a wealth of information that might be a source of information to answer some of these questions. So I think your question is really one that we're all asking ourselves, which is, if we put these kind of questions out here, who can go and identify interesting and new places that they might be able to find a source of an answer for us? So the answer, in short, is anywhere.
All right. Maybe just expanding on that, there's someone who said that they're new to this, so which data set and how to access it? So I think you explained some of that, but maybe you just want to review that you need to have permission to use these data sets.
Absolutely, that's right. So this challenge is really limited to people who do have authorization to access data sets in Canada. And there are many people that fall into these roles in different kinds of organizations. Some might be researchers, some might work for an organization that has health data holdings. And so it is the responsibility of the participants to identify data sets that they can access. There will be many people that are not eligible to participate in this trial, in this challenge, simply because they don't have access to healthcare data sets. It is a specialized group of folks that are going to be able to participate in this challenge. And once you've identified the data sets that you might be able to use, you then have to make sure that you understand the rules and guidelines that are appropriate, that are required for you to be able to access it and do this kind of submission. And all custodians of health data in Canada have those kinds of rules in place. Okay.
Well, we're certainly putting you on the hot seat, Simon, but you're doing a great job. Is there a limit to the number of teams for a particular organization?
Nope, there's no limit to the number of teams from an organization.
Okay. And then another question here. Can I submit something I've already used or published or gathered in the course of another project?
So if you've published something in a public or peer-reviewed journal or presented it publicly, then it would not be eligible for submission. But if it's unpublished work, then absolutely.
Okay. Although we said we weren't, let's see, here's another one. Does the time frame relate to today's date or the date of collection of the data?
Sorry, could you repeat that?
Sure. So does the time frame relate to today's date or the date of collection of the data?
And the time frame is, I wonder if that's a reference to the to within the question set.
Probably.
I think we might need a little bit more specificity around that question from the person who asked it to understand what that means.
Okay.
If it refers to the time frame that's listed within the challenge questions, that time frame refers to the time window, not today's date, but the entire window from which we'd like a data the data submission.
Right. We've had a question that I think I'll be able to answer, so you can take a breather and see that this question is, will this presentation be posted, and will we be able to share it after the fact? And so certainly on the ImagineNation Challenge website, this presentation and actually this whole webinar will be posted. We'll get it posted in the next couple of days, and for sure, please share this presentation because the more people we have competing in the challenge, the more we like.
So we have one of the questions that came in related to question 6, which is the Choosing Wisely Canada question, and I probably should have spoke a little bit about that. It is a multi-part question, and you can answer any one of those questions. And so each answer submission would be for a response to just one of those metrics that we're looking for, one of those baseline metrics.
Okay. I think you can answer this question pretty easily too. Can a team be made up of more than one organization?
Yes, absolutely. Multiple organizations can participate on a team, and that sounds quite innovative. Hint, hint, nudge, nudge.
Is it possible to get a representative submission, and what level of detail is required?
So that's a tough question, and representativeness obviously is a subjective concept. Our judges will be looking at it with the same lens that it was presented on that slide, which was how well can this answer be used to inform pan-Canadian policy decisions. So you're going to need to use your own judgment in doing the analysis and looking at the data sets you use to try and determine what would be most representative from your perspectives. In many ways, think of it like you would a peer review submission to a journal, which is that you can never quite guess who's going to read that submission, so you need to do your best job to frame it in a way that you think will be appealing to whoever the reviewers are.
Okay, great. Now we're being asked, so for those eager teams that want to answer more than one question, do they have to send all the responses in at the same time?
Nope, you may submit as many different answer submissions for different questions as you like, and submit them whenever that work is complete. So by all means, we're encouraging people to submit their answer submissions as soon as they have them done, because of course time is of the essence, and speed is a big reason for getting points.
Great, thank you. And so with that then, the speed of the answer, no matter which one you're answering, it's sort of, as long as you submit it, the answer will be time-stamped according to when that particular one was.
As soon as it comes in through the website, it gets time-stamped, and you're in the queue for that speed of submission. Okay.
Do the awards received have to be used in any certain way?
The awards received can be used based upon the wishes of the team or the organization. So when you register, you'll be asked who any award should be made out to, who the check for any award should be made out to. For some people, they will be eligible to accept those awards as individuals and do with those awards what they wish. For some organizations or some individuals, it may be necessary for that award to flow to an organization, and the organization may choose to do with those funds what they wish.
Okay, and further clarification to our time frame question, it looks like, so for example, must include 1 year of data which is no more than 5 years old. So is the 5 years old related to today or date of collection?
Yes, good question. Yes, so the 5 years old would be related to today. So that the time window we're looking for data that is not older than 5 years old, and we're looking for 1 full year of data within that 5-year window.
Okay, and with regards to sample size, when you're referring to a minimum, does that refer to the numerator, denominator, both? How does that work?
That would be the denominator.
Okay. Let's see, there's still questions coming in here. Again, I think we've answered this question, but maybe just to reiterate it, are the submissions going to be published, and will it be accessible to the public?
Yes, so the submissions, following the completion of the judging process, all of those submissions will be made publicly available, and that's one of the important eligibility criteria, is that you have to be able to put forward data that can be viewed and can be made publicly available.
Okay. Please keep the questions coming in. They were flying in fast and furious. They've slowed down a bit now, but we're still happy to answer more questions. The next one is, does the raw data need to be submitted? Will that data be public or just the answers?
Excellent question, yes. So no, the raw data does not need to be submitted. So the answer submission template is actually quite a brief template. It's a page-long template. Depending on the response you add, it might extend to a page or two. But we really are looking for the answer to the submission. We're looking for the summary finding, and there's no reason that there would need to be a submission of any data that would have privacy or sensitivity issues with it. So absolutely, this is just the answer we're looking for, not the raw data.
Okay, and this next question I think I'll answer for you, and it's like, who do we contact when we have questions? And so certainly you've seen already that we have the Ask the Expert, and so if you are actually directing a question to the expert, and that's one of those 10 submissions, you can email experts at infoway-inforoute.ca. But if it's a general question about what's going on, like how do I log into the challenge backend or system, our support email address is innovation@infoway-inforoute.ca. So that's where you can direct all of your questions to. I noticed that one thing that we omitted on the slide deck here is the actual challenge site, but hopefully all of you are aware of it already. But just in case you're not, it's Imagine with the E Nation challenge.ca. Any further questions from our audience, please ask them. If there are specific questions about the 6 questions that we've put up, we are not answering those. Try not to give an unfair advantage to anyone if it's specific questions on what to deal with. If it's something we feel that, if you're asking those types of questions and we feel that it's something general that everyone needs to do, we'll definitely update our FAQs on the site and get back to you at another time.
And thank you again to all our participants for joining us today. This does conclude today's web conference, and you may now disconnect. Have a great day.